All righty. Well, Verizon says it's 8 o'clock, and those of you who know me from my speakership days knows the meeting always starts on time. So good morning, everyone. I'm Dr. Art Veyer. I am currently president-elect of the Medical Society of Virginia, and welcome to MSV's webinar on the human resources perspective for returning to work following the initial COVID-19 shutdown. Our guests today are Gilson and Ritter Jonas from OneDigital Health and Benefits. Anne holds a master's degree in business administration, has 25 years of internal and external consulting experience. She currently serves as the regional managing director of HR consulting with OneDigital, and Ritter Jonas is a business development executive at OneDigital. He partners with companies to develop a multi-year employee benefit plan that will help lower costs, improve employee engagement, and ease their administrative burden. Ritter has over 10 years of professional experience following his graduation from Hampton-Sydney College. And before we start, I'd like to remind everyone that MSV and its staff has continued to work diligently to pull any and all relevant resources related to COVID-19 on our website at msv.org/COVID-19. We will post a recording of this call on that webpage later today, should any of your colleagues like to listen and could not join us this morning. Unfortunately, due to a technical error, CME will not be available for today's presentation. We do have a large number of people on our call, and we understand that there will be a number of questions, so please use the chat function on your computer. We ask that you keep your questions on topics addressed today, and if we don't get to your question or you have one on another topic, please email government affairs, which is GOVT affairs @msv.org. And with those logistics now out of the way, please welcome OneDigital.
Thank you very much, Dr. Veyer. As you mentioned, we're gonna talk about some important topics when it comes to returning to work. As Virginia continues to open up, there are some considerations around benefits, but especially HR, that as our employees are returning to a much different workplace, we want to share with you some of those thoughts about the logistics of bringing the employees back to work, but also the emotional impact of how they may have been feeling over the last few months. So along with my colleague Anne Gilson, we're going to touch on some of those topics for you today. The title of our presentation today is transitioning to the future. So some strategic HR and benefit considerations for returning to work. And what we're hoping to cover today is post-COVID-19 plan, thinking strategically. So what does that look like? So as you're bringing your employees back to work, are you covering all the bases? And is it an opportunity to maybe think a little differently than you had thought before from an HR perspective? Strategic leadership planning for both the short term and the long term. Unfortunately, we don't know the full impact of COVID-19 and how long this may last, but again, another opportunity to maybe think a little differently. And then we'll touch on the Family First Coronavirus Response Act, that's the emergency sick leave and the expanded FMLA. So as we're bringing employees back to work, this is something that you may not have had to deal with before, but will likely have to maybe deal with this as school is up in the air and other things for the fall. So and then we'll finish up with how to handle employee benefits for laid off employees. And any questions, as Dr. Veyer said, just put them in the chat function, and we'll get to as many of them as we can. So with that being said, this is we believe this is an opportunity to really think differently and think strategically when it comes to not just employee benefits, but the full holistic employee experience. So the benefits are just one portion of it, but as they're coming back post COVID-19, it's really an opportunity for us to examine, how are our benefits, human resources, employee experience, and their financial well-being all tied together. How are they tying together to provide a great employee experience? Employee benefits is just one portion of it, but as we're looking to return to work, there are many ways that I know we're helping our clients around the state to lower the cost of their employee benefits without sacrificing the value to their employees. There's numerous different funding mechanisms that could be examined, different benefit changes, but we want to make sure that the benefits are continue to be used towards recruiting and retention of your top talent. From a human resources and employee experience perspective, Ann is going to touch on those, but really the important pieces of those are, we've got a different type of workforce now in many cases, remote workforces, but communication and keeping those employees connected is going to be extremely important, going forward. As we look at financial well-being, many that have been laid off or furloughed may have some financial concerns. So we just want to be cognizant and empathetic towards the employees as they're returning to work, that there's a bigger financial picture that they're dealing with at this time. So I'm going to pass it off to Ann to touch on some of the HR topics.
Thank you, Ritter, and it is an honor to be present with each of you this morning. For those of you who are watching on the recording, the information that we're providing here is based on a whole series of information that we have been collecting over a significant period of time. The OneDigital response to COVID literally started in March, and many of you are aware, and as MSV has resources, we also have information that we can assist you in the process. My name is Ann Gilson, and I lead the regional HR consulting practice for the employee benefits organization called OneDigital. What this graph shows you is unemployment. And as many of you know, 2 weeks ago, the unemployment numbers exceeded 2.1 million. Last week, it was an additional 1 million claims that were made. The job losses across the Commonwealth and our nation and our world are far in excess of the 4 decades of gains, of job gains. And to the extent that our friends and our families are being impacted by this virus, that are literally dying and having a dealing with each and every one of these situations. So what I would like to do today is walk through a couple of perspectives as it relates to the COVID virus, employee returning into or back to the workplace, or back, in some cases, returning to work. So I'd like to set the stage. What you see here is an economic curve. The 2 triangles are our model of what HR provides to organizations. And as you can see in terms of the foundation, that we look at compliance, operations, safety and wellness, all the way up to the pinnacle of culture, and how we get there and what are the actions and activities that you would as a leader do within your organization. But really the message that we're trying to deliver in this particular picture is to say that as things shift, as unemployment goes up, as the job losses go up, as you start to think about the revenue streams and the impact that this virus has had both on you and your families, on your workplaces, that the kinds of actions and activities from an HR, from a people perspective, actually shift. So as you see, during the COVID, you kind of literally go down the curve. And then there's, some of you had to stop operations. Many of you had employees that were either furloughed or in some cases on a longer term basis laid off. And as we start to, enter June, the phased approach that the Commonwealth has adopted and the various localities by county that have shifted and started to open their doors and started to think about what are and how can we provide services both to our community as well as to our employees. So it's just an opportunity for you to think through that strategy. In 2020, OneDigital provided a series of HR trends. And recently we COVIDized this. We looked at it from the filter of the impact of HR trends and this virus. And many of you, I'm sure, I personally did absolutely experience technology in a different way. I used to talk about technology and really cool AI and robot learning and data analytics and all sorts of really amazing things that from a people perspective, how we could leverage technology. And to be honest with you, in March, it was all about getting people at work from an office perspective and being able to be set up and successful in a home environment. The technology of Zoom and GoToMeetings and webinars and using Teams and Skype and a whole host of other technologies has shifted the trend of technology. The role of strategic and personalized benefits has also shifted through this virus. As Ritter will talk through, and we have assisted organizations when they are furloughing employees. That's a term that was often used kind of for just government. And it was an opportunity that we would talk through government contractors and organizations, frankly, in the DC metro area. Whereas the last several weeks, we have talked about and how to navigate the furloughing of an individual, how to retain their benefits, what are the policies and practices as an organization that you may choose to do. There's a concept called people adhesion. And I'm not going to get too far down into the weeds of that particular model, and happy to talk to anyone about it as we go further. But conceptually, what people adhesion is about is connecting individuals within your organization so that they can deepen their expertise and elevate the trust among and between those individuals and your organization. The human experience, as Ritter just shared, is different. I don't know about the rest of you, but there was a point in time, let's call it January of 2020, where if I was on a Zoom call and somebody had a cat that came across their lap, or if there was some sort of either an animal or frankly a child, that you could hear the family noise in the background, there may have been my perspective that said something like, wow, maybe they should have thought through getting on this Zoom call. Whereas to be honest with you today, the human experience, I smile as small little people come and sit on laps of their moms and their dads who are trying to get work done. The human experience is a whole different view based on what has happened in this COVID thing. And I would encourage you as leaders to consider continuing some of these perspectives as individuals do come back into the workplace, back to work in ways that we will honor those shifts, honor those changes and those experiences. Wall Street, and I'm not sure about the rest of you, my 401k and many of investments have had a dramatic impact. And to the extent of the losses of jobs and the anticipatory unemployment, time will tell, but to the extent of 15% unemployment is unprecedented. It is something that, I've been around in the human resource function for decades, and these are not things that we have experienced in the past. When you think about the vulnerability by industry, the hospital and hotel, the retail, and many of you as managing through this crisis and being able to maintain and provide services and yet you too, in your industry, have been impacted. As smaller organizations started to shift, there were adjustments that were being made. And as we continue to think through the phased approach, these adjustments, whether it be furloughed, reducing hours, the impact of the insurance, whether it be medical, dental, and vision, and how you as an employer want to think through these strategies is something we can help you navigate. In Virginia, right, we've obviously seen a dramatic impact on the job losses. These are what we would consider vulnerable based on some information that I used from our partners, McKinsey. Time will tell as to what the actual impact will be. The technology is something that many of you have considered. Our experience with many of the medical offices that we partner with, there may have in fact been some resistance in the past as it relates to technology. And there may not have been an running down the street and embracing some of the opportunities to do electronic transfers, to consider the technology that would assist individuals, whether it be on an open enrollment or a variety of other things that you as an employer can assist your organization to do. And to the extent that many of us have gotten experienced with this technology very quickly in a way that I would not have anticipated. And I would again encourage you to think through and continue to use some of the technologies that in fact have assisted your organization successfully. The return to work strategy is something that is a phased approach, right? And what we would also think through and have you consider is before some of the actions. Many of you started this a couple of weeks ago. Some of you are thinking about it as you look out towards both the end of this month of June and in July. And this is just a reminder, right? There's the pre-work strategy. What are you doing as it relates to your team? What are some of the policies and practices that might need to be rewritten, updated, or changed? Again, the technology, and then the physical workspace. Many of you have already thought through these, but I wanted to kind of set the tone and remind you. We look at there's a three-phased approach: resolve, reengage, and return. So resolve, what is the plan? What's the communication plan? What are the training needs that you might want to consider? Reengage, it's starting to execute the plan, the roles and responsibilities, the wellness, the physical actions and activities, the policy and practice adjustments. And then in terms of, as you think through going back, disaster planning development. We have experienced both in OneDigital and many of our clients working with them in their disaster plans. And to be honest with you, some of them were really great. And we were able to pull it off the shelf and dust it off. And the clients were able to literally check the box and go, yep, we'll take care of that. That's something that we forgot to do, and let's do that. And on the other side, to be honest with you, there were several organizations that their plans had a fair amount of gaps. Not to say that we anticipated a pandemic. Most organizations did not even consider that in their disaster planning. And now we can make those adjustments. When we think about the recovery process, these are 8 focus areas that we have identified to be critical and to be considered. In most organizations, you're not going to have to manage all 8 of these. And we do have a process, if you're interested, that you can evaluate your own organization as it relates to these 8 factors and consider the actions that may be related to each one of these. The communication is a critical component of leadership. It is, in my opinion, the single one activity that needs to be done almost ad nauseum, to be honest with you. It is kind of a situation that says anytime one communicates to an organization, the more is in fact better. And the number of ways that you communicate, the kinds of things that you use to communicate, the consistency of your message. So this is a 10-step process, and yes, each one of you will have access to these slides that we would suggest as it relates to communication. Many of you have really robust communication tools and processes. Many of you have executed the communication within your organization, whether it be around return to work or changes within the workplace. We're not sure what's going to happen next month and later on in the year. And to the extent that the communication plan should be an ongoing, ever-evolving, living process. Safety and wellness has always been an HR to-do. It's a leadership responsibility. And many of us have looked at safety and wellness in a very different way due to the virus. The kinds of things that we have thought through as it relates to physical safety has most of the time been conversations that I've had with organizations in a manufacturing operation. The kinds of safety discussions that are now being held in workplaces such as yours, in small offices, in places where both individuals that are coming out from the outside, whether it be the FedEx guy or the postal person, as well as patients coming in for services, and how you manage that in and out. I'm not sure about many of you, but my doctor's office has one single door, and they literally ask you to sit at the parking lot. They call you in so that there's only one person in the office. And to the extent of your role as an employer and the employee's role. So you want to think through safety and wellness in a whole nother way. This particular chart is really not an eye chart. It really is to make a point, and that the mental wellness of our community has shifted due to COVID. There is no doubt in the last 2 weeks, the impact of the unrest within our communities and the racial divide and the impact of what things have occurred in our communities have also changed our ability to do our job, our ability to focus, our consideration. What these graphs are is from a partner that we have as it relates to self-evaluated data. So it's how much control do I feel? How much anxiety do I feel? And to the extent that this lack of control on the top half of 3 charts, which is dramatically going down, and on the bottom half of the 3 charts, that the impact both of addiction, anxiety, and depression are going up. This is not a medical study. It is, again, self-reported information. And my point here is to remind everybody that these things that happen both because of COVID as well as the social unrest in our communities absolutely have an impact on your employees. And the question I would encourage you to think through is, what might you choose to do about it? Managing health and safety is as simple in some cases as PPE, as well as more broader mental awareness. One of the considerations that we have tried to deal with and help navigate our clients is, what if an employee doesn't want to return to work? There are some considerations as it relates to FMLA and ADA. There are some opportunities to use, depending on your policies and practices, for unused sick time or vacation, the feasibility of remote work. At the end of the day, right, you're an employer, and if you demand that an employee must return to work, that if there's not a medical reason, that is a choice and a conversation. I might strongly advocate that you participate in an open dialogue with your employees, that you are literally, physically present for them in a discussion about why they don't want to return and how might you be creative and considerate of their current circumstances. These are uncharted waters. The opportunity for you as a leader to show up, to drive the culture in very clear and demonstrated ways is something that you might want to consider. No matter what kind of plan you have to return to work, I would encourage you to consider it a living document. It will change, it will shift, things will not be anticipated correctly, and that is why we have a plan that continues. So thank you, and I invite my colleague, Ritter, to take over.
Thank you, Ann. Next, we wanted to talk about the Family First Coronavirus Response Act because, you know, many practices may not have had to deal with FML before, but this brings in the addition of emergency paid sick leave and emergency family medical leave expansion act. So two components that are new, especially if you're bringing employees back to work. And we wanted to make sure and give you some scenarios and show you a tool that we've created to help in this process, because it can be very difficult to determine in certain situations what you're required to do, you know, how much you're required to pay, you know, as part of the FFCRA. So some of the top questions that we get, and you know, what if an employee is afraid of meeting in a group and refuses to come to work? So, you know, Ann, I know just touched on this from a different perspective, you know, in terms of thinking about the impact of letting that employee go or whatever that, you know, your decision may be on that front. But from a traditional FMLA, from the expanded FMLA or the emergency sick leave, you are not required by law to hold their job. It is part of a bigger picture to make sure you're making the right decision for your practice and for the morale in the office. But legally, you're not required to do so. What if an employee is immunocompromised and is advised to self-quarantine? Or what if the employee is experiencing symptoms of COVID-19? So, you know, through traditional FMLA, no. The expanded FMLA, you're not required to do anything, but sick leave, yes. And that's, you know, essentially 2 weeks of sick leave that you would need to, you know, pay this employee while they were out, but they are not subject or eligible for the expanded FMLA. What if they have tested positive? So similar to, you know, they were feeling ill. If they are actually ill or severely ill, if you are 50 or more employees, then you do need to give them access to traditional FMLA. So meaning holding their job unpaid for up to 12 weeks. And the maximum that you would need to pay them would be just for the emergency sick leave for 2 weeks, up to $511 per day, or a maximum of $5,110 for 2 weeks in total. So, you know, this can be, as you can see, that this can be somewhat difficult to kind of determine which way you need to go. This is a big one. You know, what if an employee does not have childcare? as the Commonwealth reopens, there is talk from Governor Northam about, what the fall school situation may look like. But it looks like it may be on a tiered approach. There might be some children going one day and another group of children going another day. So this is something that may come up more and more. So if they do not have childcare, if they do not have a school to go to, what does that look like? So under the FFCRA, they are technically subject and eligible to receive the emergency FMLA expansion in addition to the sick leave. So it provides 12 weeks of paid leave for them. Now, it is not at their full rate of pay, but it is at a 2/3 of their regular rate of pay, or the minimum that they've set for that. I do want to show you a tool that we have created for this very reason, and feel free, if you're interested in seeing this tool, please email me and I'd be happy to send this over to you. But we have put together a tool for our clients that allows them to look down the list of scenarios here and then scroll across to see what the requirement would be. So in the situation that we just chatted about, school or other place of care is closed due to COVID-19, an employee has no child care for their son or daughter. So under traditional FMLA, that would not be required. Expanded FMLA, yes, and it gives you the reason code. Emergency paid sick leave, yes. And then it will tell you what employer action needs to be taken. Provide paid sick leave and expanded family medical leave for full and part-time, and how much you would need to pay them. We've also included in the yellow boxes a calculator. So you can put their rate of pay, the number of weekly hours, and it will calculate for you how much. So let's say they make $15 an hour, then you would, over the course of the time that they're out, they would be eligible for up to $4,800 of both sick leave and expanded family medical leave pay. So if you're interested in seeing a copy of this tool, be happy to send it over to you. Just my email's at the end of the presentation, and I'll send it over to you. Bear with me one second here. So in terms of benefit considerations due to furlough or termination and layoff. So if you furlough employees, if they continue to be you are not responsible to meet the needs for the FFCRA, the Family First Coronavirus Response Act. So you're not responsible to pay them the emergency sick leave or the expanded FMLA. Many carriers are allowing employees with the reduced hours to remain on the health plans if the premiums are paid, but check with your broker or your carrier to see how long they're going to allow you to stay on there. Employers can terminate the health coverage and offer COBRA due to reductions of hours. So if they are laid off, or furloughed, you can take them off of your plan if it's a need for cost cutting. You can take them off their plan and offer them COBRA during the time that they are working reduced hours. Life and disability, or what we call ancillary lines, use contract language for furlough and unpaid leave of absence, but check with them to confirm how long they'll allow the employees to stay on, or if you're able to take them off and offer them portability or conversion features. In terms of termination and layoff, in this case, you are truly severing ties with the employee. So no FFCRA paid leaves. You would go ahead and offer them COBRA for any group health plan if the contract remains in force. And then again, check with the life and disability carrier for any contracts end dates there. As they're returning to work, if employees remained or were furloughed and remained on the health plan, there's no onboarding or re-enrollment required. But for employees that were terminated from the health plan, the employee benefits can be reinstated. Now they're now eligible for the FFCRA paid leaves. Now furlough being a little bit different than your termination and layoff because they technically remained an employee, just not active. That's why they're able to come back on without the full onboarding process. If you did terminate or lay off employees, they must be rehired and can enroll in benefits as if a new employee. So the full onboarding process would be required there. And then they are now eligible for the FFCRA paid leaves. One trend that we're seeing, we've seen over the last 3 to 4 years, has been using HR technology to help streamline the process from an onboarding perspective. And so this may be the time as you are bringing employees back to maybe, especially if you're bringing quite a few back at a time, maybe time to consider using HR technology to streamline that onboarding process and do things electronically. As Ann mentioned in her portion of the presentation, a lot of our clients are considering how to do things differently from a technology perspective. And so this is one piece that has been out there for quite some time, but we're really just starting to see employees engage and embrace HR technology. And frankly, with the new workforce, we're starting to see employees ask for their employees to engage with them in a very different way. So just something to consider there. And then lastly, I wanted to just make sure that you were aware of our coronavirus advisory hub. We have a team down in Atlanta that has been posting and collecting all kinds of information, great articles, blog posts, all of our webinars that we did throughout this crisis. It has been a great source of information for our clients as a one-stop shop to look and find anything that you're curious about as it relates to the coronavirus. So we have this information out there. The link is on the presentation, but again, happy to send that to you as well. So finally, just want to be able to answer any questions. If there's any questions moving forward, feel free to email me. This is my email address, and happy to send the FFCRA tool over to you. So any questions that anybody had on the chat function, Taylor?
We've got no questions so far. If anyone does have any, please type them into the chat box, and we can ask them of our panelists. Well, obviously the presentation was so good, no one does have any questions. So, well, seeing none, any further comments, Ms. Gilson or Mr. Jones?
Well, I would just like to thank you for the opportunity to present to everybody today. We really strive to at OneDigital to as the employee benefit partner for the Medical Society of Virginia, to think differently and highlight some ways that we can certainly engage with our employees, because employee benefits is just one portion of the picture. As you can see from the wheel up above on the top of the page that we're showing, it's just one of the ways that we can engage with our employees, but we feel like there's other important ways as well. So really appreciate everybody's time today. Ann, did you have any parting thoughts?
Thank you, Ritter. Thank you, Dr. Berry. Yes, I think that it's an opportunity for each of the organizations from a leadership perspective, from an individual perspective, and as an employee, coworker, colleague perspective. is to think through and reevaluate all of your current practices as it relates to the people side of your business. And I do believe that your organization will benefit from making adjustments which are aligned with your values, are aligned with your mission, as well as your objectives. Thank you very much for the opportunity.
All right, actually, we do have a few questions that have just popped up. First one says, I have only 5 staff. My nurse practitioner has cut her hours due to childcare problems. Can I decrease her pay?
Yes, to the extent that you want to make sure that you manage through, as Ritter walked through, the FFCRA implications. There is a time period where that will then end, and depending on when that occurs, you then can reconsider the actual payment of that individual. So to the extent where for the 12-week period, they can sort of increase the amount that you're paying them and what they will receive through the additional funds. And then as that kind of ends, then you absolutely can reevaluate the current structure, as well as a decision that you make from an employer perspective. You can pay them additional funds. There is a risk that you would and should be aware of, and we would not necessarily advocate that you, quote, make them whole through this whole thing, and consider other creative ways to do it. I'd be happy to, if you send Ritter a note, we could walk you through some of those options.
All right, thank you. And another question, and I like this one because as only Washington, D.C. can do. If a furloughed employee refuses to return because they are happy with their unemployment pay, how long can they collect that?
Yeah, that's an unanticipated, I think, consequence that there was a fair amount of conversation prior to when the law first came out and said the additional 600 weekly funding would have that direct impact on many organizations, that their employees would in fact be earning more with the additional pay as unemployment versus if they were asked to return to work. I'll go back to some of the things that Ritter and I shared earlier, that you as an employer have a responsibility for a period of time to maintain the furloughed concepts. There is a point in time where that ends. And at that point, I would encourage you to proactively communicate to your employees, both as an organization holistically, and then specifically to the individuals impacted. And I would encourage you to talk through and listen and then make a decision based on specific criteria that you have as an organization defined, that you will consistently apply, and that in fact thinks through and manages based again on your culture, on your organizational structure, and what you believe to be the right way to handle things. But at the end of the day, if you as an employer say to the individual furloughed, it's time to come back, and that your individual chooses not to come back, you can take action, including termination.
All righty, thank you. And then last, actually not a question, just a comment. Thank you, great presentation.
Thank you.
All righty. All right, well, I thank our panelists, Ms. Gilson and Mr. Jones, for your expertise and very good session that we had this morning. So thank you everyone for attending. And again, sorry about the lack of CME, but I think the information was certainly worth the time. So I hope you all have a wonderful morning, and in the words of our MSV president, stay safe and wash your hands.
Thank you. Have a great Friday.
All right, you too.
Bye-bye.